Hello, and a very good evening to everyone who has joined us on Facebook Live and YouTube Live. Welcome to the I Am Fat for Growth program in conjunction with the Growth Watch Month Forum series. My name is Jaleesa Sanjana, and it gives me great pleasure to be hosting this forum series once again. And before we kickstart our series here today, to all of our viewers who have just joined us, well, we would also hope for you to drop in all of your questions or perhaps you would want us to enlighten you better on each topic during our discussions. Well, drop it over via Slido, and all you have to do is just scan the QR code as well as to hashtag IamFat. And of course, our technical team will also be dropping the instructions for you where you can see it right there over for our Facebook as well as our YouTube users. So now, ladies and gentlemen, I'm sure most of you are also very curious to know more about what I Am Fat is all about, especially our programs. Well, I Am Fat was actually launched in 2012 by the Malaysian Pediatric Association, focusing on healthcare professionals and parents in optimizing children's growth. And as you have watched the video earlier, we would also like to share the good news with you that I Am Fat has recently launched the Growth Watch Month to raise awareness, all right, on the importance of good growth for children and adolescents to prevent stunting. All right. So with this now, I would also now like to warmly welcome each and every one of you, especially for parents, to join us in this forum. And this is, of course, going to be the third forum in the series. And we will be discussing on the theme today, which is rather exciting, I would say. This time we will be talking about healthy bodies, happy kids, the parenting tips for growth, health, as well as happiness. All right. So together with me today, of course, I would be having a very, very insightful discussion, I would say. All right. I would be having two of our I Am Fat experts. And this time around, we have Professor Dr. Firdaus Mukhtar, as well as the Associate Professor Dr. Nurazlin Kamal Noor, who will be here with me in a bit. So to give you a little bit of an understanding about who exactly our I Am Fat experts are, maybe we can talk a little bit about the backgrounds as well. I'm sure most of you are quite curious. So starting off, we have Professor Dr. Firdaus Mukhtar, and she is, of course, the member as well as the as part of the I Am Fat expert panel. She's also a clinical psychologist at the psychiatry clinic in the Hospital Pengajar University Putra Malaysia. All right, the deputy dean at the School of Graduate Studies at University Putra Malaysia, the president of the Asian Cognitive Behavior Therapy Association, and that's not it. She was also awarded the Young Women Scientists Award in 2012 for her vast contribution in mental health research. Okay, that is a very, very long list I have there. And joining her, of course, this time to the addition of the I Am Fat expert panel, we have the consultant development pediatrician at Pusat Perubatan Universiti Kebangsaan Malaysia. And she is also an expert in autism spectrum disorder, child development, child maltreatment and neglect. And also she has contributed tons of articles. You perhaps have heard her before on Astro Radio, on BFM's radio, as well as seen her on Al Sihah magazine, as well as Utusan Malaysia. So please welcome both of our professors here today on this platform. Hi there. All right. Okay. So with that, I believe that, we are all in safe hands, of course, and this is going to be very exciting for all of us because not only are we going to be covering all of these topics here today, but we are also going to be having a discussion. So again, very quickly, I would like to just remind all of our viewers, especially to parents right now who are here with us on this platform, if you have any questions, drop it over via Slido and we'll be more than happy to answer all of your questions. All right. So starting off today, I am going to dive very, straight into the topic that I have here, which is healthy bodies, happy kids, the parenting tips for growth, health, and happiness. And if previously on the other Growth Watch Month Parent Forum series that we had also discussed other issues, especially when it came to toddlers, preschoolers, and teenagers, and the fundamentals as well as nutrients, sleep, physical activity. We have covered quite a bit in the previous series. So this time around, we will be discussing on the children's growth from the perspective of the psychology, developmental, and the behavioral issues as well. So, of course, we all want our kids to develop and grow in ways that are healthy and appropriate. So, this also includes how children will grow physically as well as how they think and behave, which is, I would personally think that that's also a very important thing to cover. So, it's a good thing that we have this topic here today on the third series on this forum. All right. So, as such, I think this time we would like to make it a lot more easier, I would say, for all of us to relate to it and to have a better understanding. So, to start off our forum discussion, I would now like to share with you the first scenario. And if you're listening to me, or perhaps you have just joined us over here, if this is something that is relatable to you, I think this will be a good time also for you to take down your notes and at the same time to drop in your questions, okay? So the first scenario that I have here is a very interesting one, and I hope both of our professors are ready for this as well, okay? So this time around, the first scenario I have is a 7-year-old boy who wears diapers to bed at night, and he has been wetting the bed, okay, almost every night for the past 3 months. He's, of course, a healthy boy, except for slight cough and fever that he perhaps, caught from other children. His motor skills are also quite good. Okay, so we can tick that on the box as well. And he can hop, he can skip, he can stand on each foot for 5 seconds. So everything seems quite normal. Okay, and he also has he can get dressed without help at all. And his speech and behavior are age appropriate. Okay, so this is the very first scenario. And his past medical history, if let's say we were to tap into that and to look into it, his physical examination, all of it shows no issues at all. Okay, however, his mom here in this first scenario is a bit worried because his friends has been teasing him about not having a father, as no father, all right? And because of that, both the parents are divorced. I mean, the reason to that is because both the parents are divorced, and this happened 2 years ago. So based on this scenario right now, so for us to have a better understanding of this, is it normal for a 7-year-old to still wet the bed? And is there really a cutoff age, okay? A cutoff age for kids to actually stop doing that. So I'm going to direct this very first scenario and the first question over to Professor Nurazlin. This one is for you.
Thank you, Jaleesa. So is it normal for a
All right.
7-year-old to still wet his bed? Basically, when we look at this child's development, it was essentially normal, right? But we also need to understand about bedwetting, right? Children develop ability to control their bladder over time. Generally, we expect that between maybe 3 to 5 years of age, but some children maybe develop full control later. In general, problems with what we call nocturnal enuresis or bedwetting is when we see children age 5 or more who wet their beds at night more than twice a week for more than 3 months. But there are some children who are still normal, who still have accidents or bedwetting incidents that occur maybe once a week, even at different ages. For example, in 5-year-olds, about 20% of them can still have accidents or bedwetting at night. In 7-year-olds, about 10%. By the time they get to their teenage years, let's say in a 15-year-old, it should really go down to 1%. So although there's no exact cut-off, we do see that as children get older, they should do this less frequently. And in a child who has already managed to attain dryness at night, if they then lapse back into this, then we have to think about why this has happened.
Okay, all right. So it's a very clear understanding as well. The older the child gets, then perhaps it comes off as a very natural thing that, it doesn't occur as frequent as how it would be when the child is younger, right? Is that safe for me to say, to conclude?
That's right, yes.
All right. Okay, so we have that good understanding of that. So this also now leads me to another part of it. Since we understand that, as a child gets older, it should come as a very natural thing for a child to stop. But could there be a reason for why the boy is bedwetting at this age, at 7? So I would also want to hear it from both of you this time, but maybe we can start off with Professor Firdaus this time. Is there, a reason that perhaps you could point out for us? Is there any, reason to that?
All right. Okay. Thank you. From the psychological perspective, lots of time the frustration coming from this case is actually coming from the mother, where the mother, people blame her that she's lazy, to get the son up in the middle of the night. Yeah, maybe the boy is actually having low IQ level, things like that. So first of all, the most important note that we need to highlight is this bedwetting is typical. This is a common developmental issues that could actually resolve over time. Yeah, but this is not due to laziness. This is not intentional behavior, but most probably this could also influenced by the psychological factors. Yeah, in terms of emotional or psychological factors, some children might experience stressful life events, changes in routine, anxiety, or some children could actually experience emotional factors such as feeling overwhelmed, or they experience a significant life changes, such as changing school, moving to new house. So all this could actually contribute to the bedwetting in some cases. The other part, it is more medical. I believe Prof. Azlin is more expert to discuss it about. Yeah.
Thank you, Prof. Firdaus.
Okay, all right.
That's really important because this is a child whose development was essentially normal, who then attained being dry at night, and then went on to develop bedwetting. So we think about what are the possible reasons for this. It could still happen in about 10% of children of this age, so we won't label it as absolutely abnormal. But because if it is a change from the ability to from him being dry at night, we consider about whether there might be conditions that might have led to it. So firstly, in terms from a medical point of view, we determine whether there might be some medical reasons such as infections. A urinary tract infection could cause a child to have bedwetting at night, right? Because it might be painful, because of reasons related to the infection itself, the child might lose control of the bladder. Other medical reasons that we consider is whether the child has conditions like diabetes mellitus, whether the child has been drinking more frequently at night compared to the daytime, making it harder for him to hold urination until the morning, and whether there are some other conditions, especially with relation to their development and their physical findings. So we ask more questions about whether there are specific possible medical issues, and we try and examine the child to see whether there's any causes medically for why the child has bedwetting. In addition to this, as Prof. Firdaus has mentioned, we have to see the child holistically, and taking into account emotional causes, behavioral and psychological causes is also very important when there are changes in behavior or changes in routine.
Okay, all right. Thank you so much, Professor Firdaus, as well as Professor Nur Azlin on this, because I think the clarity and how you had both given us that perspective is very, very clear. So on one side, we also have to look at the life events, but sometimes it's also, like you said, very nicely about looking into the medical side of it. If you're feeding your child a lot more water before bed, perhaps it's as simple as that sometimes, right? It comes to us as that. So for all of these things that surrounding this topic that we have here, which is bedwetting. Okay, so I would like to continue a little bit on the conversation earlier with Professor Firdaus. So if that is the case, what are the signs that parents should look into or beware of in this case? If their children are going through any psychological issues.
Okay, this is a very important part, where we really want to educate parents, in order to be aware of the early signs or the red flags of the symptoms, or what the children actually going through, especially when there is a impact, significant event that happened in their life. Okay, so first of all, the one that is very easy to detect is the changes in terms of the behavior. Okay, so for example, the parents notice that any changing in the behavior, such as excessive crying, aggression, withdrawal, sudden decline in the academic performance, or this could be the sign of the psychological distress. Yeah. The second changes is in terms of the emotional changes. Yeah, significant changes in emotion, such as persistent sadness, frequent fearful, anxiety, excessive worrying, or unexplained outbursts of anger. Yeah, so this is something that should be monitored. Number 3 is the sleep and appetite disturbance. Yeah, either they have struggled to actually to sleep, or they sleep a lot, or they don't want to eat, or they eat a lot. Yeah, so that actually lead to the significant increase or decrease of their weight. Yeah, so this is something that is obviously something that parents should be worried in order to explore further. Yeah. Number 4 is the social withdrawal. If the child start to isolate themselves, okay, from family activities, doesn't want to talk to friends, doesn't want to go out, have low interest in enjoyable things that they previously used to, so this may suggest the emotional difficulties. And the last but not least, one of the common sign that parents need also to be concerned is the changes in terms of the physical complaints. Yeah, so physical complaints sometimes is quite easy to be concerned or highlighted by the kids because they are going through some kind of pain, such as stomach ache, headache, fatigue, or any unexplained physical complaints. So this is something that parents shouldn't take it lightly. Okay, so this is where further evaluation, further reference to the mental health professionals or to the nearest medical doctors should be done as soon as possible.
Okay, all right. Thank you so much, Professor. Because, a lot of parents, I think, are also unaware, especially when they have to look out for signs like this. So thank you so much for a very strong breakdown of that and also, of course, a better understanding of that. All right, so now, once again, to all of our viewers, if perhaps you have just joined us halfway through, well, this is still the right time for you to drop in all of your questions. If you would like any one of our professors to answer any of your questions, it's easy breezy. You just have to scan, okay, this QR code right here. And with the code of IMFET, you could drop it over. And of course, we would answer all of your questions during our Q&A session. All right, so now that we have covered quite a number of the sections of this entire topic that we have, let's also now look into the parents' perspective of this. All right, so if, let's say, how should parents approach their children if they do detect that their children are having emotional or behavioral issues? Do they confront them, or do they give them more time for the children to adapt and to also manage the changes? And I think this is also a very beneficial question, especially for parents who are, rather new, and a lot of things which are very foreign to them in terms of how to tackle issues like this when it comes to their kids' behavior. So over to you back again, Professor Firdaus.
Okay, right. For this question, I would like to highlight the different types of parenting style first, okay, in order for us to understand what type of style that we actually approach or handle our children. Okay, so basically, some people might actually have the idea of helicopter parenting, tiger parenting. Okay, so let me put it in more easier way, but where we have 4 types of parenting style. First is the authoritarian parenting style. This is where the tiger parenting is. They are very strict. They put a very high expectation, especially on the academic. Okay, they want everything is in their as they are in their own way. Okay, there's no very little or almost none rooms for the children to share their feelings. So they are very strict about handling their kids. There's no kind of thing. Okay, the second type is the permissive. The permissive parent, usually they are having all this expectation. Okay, but they don't actually guide them throughout. Okay, so they don't they have minimal guidance. So that is where they are giving mostly freedom to the child. Okay, but very little discipline for them to achieve what they want. The other types is the indulgent. The indulgent one, or the neglected one, is the one that is actually giving total freedom to the kids, where they don't actually take any responsibility to manage their feelings, to manage their expectation, or to manage their behavioral difficulties, because they don't see that is their priority in life. Okay, the one that we want to highlight, okay, for parents to approach and handling the children, especially if they detect that the children are having emotional or behavioral issues, is to apply the responsive parenting style, or we call authoritative parenting style. Okay, so what the responsive parents think style do, okay, so they usually will create a safe and supportive environment. Okay, so they try to ensure that the child is comfortable, okay, to express their emotion, and also they offer the child, they reassure the child, okay, that they want to listen and they really want to support them. Okay, the second one is the positive or the responsive parents. They will choose the right time and place in order for the children to feel calm, yeah, in private setting, in order to talk about the difficulties, right? The third one is the responsive parents will try to have try to be attentive and also practice active listening. They give their child full attention and listen to what they want to say. Okay, they encourage them to express their emotion, their thoughts, their concern, yeah, without much interruption. And they show empathy and try to validate their feelings. So the validations of the feeling is usually lacking in most of our parents in Malaysia. Yeah, so this is something that we really want to guide and make sure that parents understand how to validate the feelings of our children. Okay. Next, maybe a couple of things that I can also share that in order to have a good communication with our children, okay, parents is encouraged to practice the open-ended question rather than close-ended. Like close-ended is yes, no answer. Where the open-ended question, instead of asking like, did something happen, bad thing at school? Okay, you can actually ask, how was your day at school? Yeah, is there anything that you would like to talk about? Okay, is there anything that you would like me to help you? Yeah, so this that give more answers for children to actually to describe their concern. Okay, rather than just close question. The other one that I want to highlight is try to avoid blaming or shaming. Yeah, so this is sometimes parents like very fast to do, okay, very easy to do because they want to solve the condition or the issues. Yeah, it's
And I
important
think
to create.
sometimes this happens in public as well, right? You
Right.
see it quite evident, right, in
Yes.
the natural way for.
Exactly. Yeah, because this is where we usually do things based on our emotion, okay, rather than give it time to actually to think about it. Yeah, so it's important to create a non-judgmental atmosphere. Yeah, try to avoid blaming, shaming our children's emotions, behavior, but try to understand and also listen their perspective before they discuss about finding the solutions together.
All right. Thank you so much, Professor Firdaus, on this, because I think a lot of us, sometimes that we are aware of these types of parenting styles, but when it comes to really, executing the correct methods in terms of how you take care of your child's emotions as well, it sometimes needs to be pigeonholed to have a better understanding out of it. So thank you so much for your answer. But you could also correct me if I'm wrong on this, Professor. It's also sometimes it goes back to how the times are. The older generation and the newer parents also have a different approach towards it, right?
Yeah, I think
Professor?
definitely there's some generational differences. But I think what's really important is that we get to know our children. We don't just ask them questions, expect them to be what we don't just expect them to fulfill things for us or be perfect, like perfect children. But it's to understand what our children's like, and to understand them, you need to get to know them. So I think it's respecting them as their own autonomous individuals, and in respecting them, you listen to them. You're not putting your own emotions on them. You're not judging them. You just love them and try and understand them.
Yeah. Maybe I can
very well
add
said.
a bit on that. Okay, just because you've been raised in that environment, okay, you've been hit, you've been scolded, yeah, doesn't mean this is the only effective way for you to apply to the same to your children. Yeah.
Yeah, definitely.
Right. I think the good thing here also is that a lot of the newer parents this time around also they are also exposed to a lot of different things online or even on different books or platforms where you have a better understanding as how it was back then, right?
Yeah, I mean, just because your parents did it one way, it doesn't mean that you have to be that kind of parent. You know,
Yeah,
we've learned to be better than that. Yeah.
I have a wide smile on. I hope my parent is listening. My mom, or perhaps, my very strict upbringing that I had. I hope she's listening to this right now. All right. So once again, to all of our viewers, we really hope that you're enjoying the discussion that we have here on this topic. And again, if you have any questions for us, drop it over, as we will be having our Q&A session coming up as well. So since earlier we were talking to both of our professors on this environmental issues, as we have highlighted as well, that happens around a child and can also affect the child's growth. So now let's talk per se about growth. Let's focus on growth for now. And here's the second scenario that I'm about to share. So to all of our viewers, as well as for our professors, this is the second scenario which we are going to trying to analyze and see exactly how we can tackle this sort of an issue. All right. So this time it is about a 3-year-old boy. Okay. And the child said that his first word, his first words at 2 years old. So I would say, for a 3-year-old, for him to start saying few words at that age of 2, he's also now able to say combined words like mummy milk, but not really speaking it in like full, complete sentences. So it's just words being placed together in order for his message to go across. Okay. He also enjoys interactive plays and likes to play with his cousins when they visit. So it seems like a very normal environment for the child. Okay. He also eats a variety of foods from leafy vegetables, whatnot. So the diet part is also quite covered. And it's also the only child that we're referring to here and who has not started going to school, to kindergarten yet. And his parents also works long hours and return home around 7 p.m. daily, okay? And they don't take him out of the house much because they are worried he might fall ill, okay? And from what we also understand, he was taken care of by his maternal grandparents, although his grandfather was also recovering from a stroke. And his grandmother allowed him to use the phone and would watch videos for 6 hours in a day. Okay, so the child here that we're referring to is a very obedient child as well and could follow instructions. Like simple instructions that we're talking about is like, come here or throw this away. Okay, and when we talk about the sleeping pattern of the child, the child would sleep between 11 p.m. to 7 a.m. and had daytime naps as well between 2 to 5 p.m. And his father had a speech delay as a child. That is the other thing that we have detected. Okay. And also, so as far as what I can understand here, there are certain developmental milestones that the child has already, mastered in a very normal development. So based on this scenario, is it normal for a child to say his first words at 2 years old and only, be able to combine like 2 words by 3 years old? Do you think this is actually normal, we could say? So a word to Professor Norazlin first.
Thank you, Jaleesa. So when we look at the development of children, there are certain milestones that they reach at certain ages. It's not exact as in meaning that you have to do it at a specific age, but if you don't do it by the average age, we would be concerned about whether there might be some delay in development, right? So for certain developmental milestones, there are goals that should be reached. So in this case, a child should really say his first word around the first birthday or 1 year of age, right? That's quite typical for children. And by 2 years, most children will have enough single words to actually combine words together, like you mentioned, saying mummy milk or let's go. So those kind of combining words into 2 or 3 word phrases tends to occur at the age of 2. And by the age of 3, a child should really be able to speak in sentences. Like, mummy, let's go to the park, right? So this is what we expect by the age of 3. So looking at this child's scenario, it looks like for the development of speech, hearing and language, there is a delay.
There is a delay. Okay. All right. So on this, right, Professor, we understand that it's quite normal for parents to also take it as by the time the child is 3, the sentences should be formed in a way so that the message can go across and, it's a better understanding. But for most parents, right, how would they actually know if a child has delayed development? Are there any sorts of red flags that a parent should be aware of? Or is it just going to be based on what they hear So is there like a proper breakdown that you could share with us on this, Professor?
Sure, yeah. So when we talk about development, there are areas of development or developmental domains. So the four main areas of development are as shown in the slide here. The first one is growth. And vision. This is related to movements, the fine movements of the hand, and it's usually coordinated with vision. So for example, picking up a cube or picking up a pencil and drawing with it, or looking at a book. So those things require coordination of fine motor and visual domain. For the third area or third domain, this is the area of hearing, speech, and language. Like in this particular child, this is the domain he seems to have a delay in, whereas the other areas of development seem to be okay. The fourth area of development or domain of development is social behavior and play. So social behavior talks about how the child reacts to other people. For example, a baby even by about 4 to 6 months of age will react to smiling at you when you smile at the baby, right? So there's some reaction to a person. As the child grows older, there will be eye contact. Of course, the child will interact. When the parents talk to the child will attempt to converse back in their own babbling sounds. And they will be able to share things with their parents by, for example, pointing at things or looking at things together. The social behavior and play also includes how a child plays. For example, interactive play, whether they're playing with other children or they're playing on their own. So when we look at this particular child, for his development, the other areas of development appear to be within normal, right? He is active, he's playful, he likes playing with his cousins, he seems to have good eye contact, but he has got delay in a specific domain, which is the hearing, speech, and language, because his expressive language, what he's able to say, is not as it should be for his age. So, for example, he is delayed by about a year for his hearing, speech, and language, whereby at 3 years, he is not yet able to speak in sentences.
Okay.
I would like to add a little bit more. So to give the holistic understanding of the red flags of the development among children, especially below 6 years old, there are three things that maybe is not mentioned. Okay. First is the cognitive development. Okay, so if there is a either regress or not forming, okay, especially that's related to the disruption of the memory skills, concentration skill, attentions of the children, inability to do problem solving, according to age appropriate activities. This is something that also consider red flags for the children development. The other two that I would like to highlight for parents to know also is the self-help skills. Self-help skills is or the daily activity and daily living skills. Such as toilet training, whether a child can dress on independently, feeding independently. So this is also something that parents should understand what age that is appropriate to be developed. And the last but not least that I believe that is quite common nowadays is the sensory issues. Sensory issues that also could actually become the points that where the parents should be concerned in order to refer to the specialist. That is where child may be hypersensitive, too sensitive about noise, texture, colors, brightness, or that, or hyposensitive. They are excessively overstimulating themselves to these sensories, textures, sounds, and all that. So this is something that also is important for parents to understand where the part that is excessive or deficits in the children development.
So, all right, so we have lots of clarity on the red flags here, per se, based on the chart as well.
Yeah, sorry, Jalisa. I was just saying, but you were asking about red flags earlier?
Yes.
Yeah, so actually this slide shows us red flags at specific ages. So if a child at this age has not done this specific thing, this is a red flag. So, for example,
Okay.
at 18 months, if a child is not yet able to understand simple commands, like come here, give it to me, or the child has no meaningful words. As I mentioned, they should say their first word at about 1 year. So by 18 months, if a child still has no single words at all, this is really a red flag that parents should be aware of and actually think about bringing the child to be seen by a professional. Thirdly, if a child has poor eye contact, so not really looking at the person that they're talking to or interacting with, and also fourthly, unable to stand alone. So this is goes back to the gross motor development. A child really should be able to start walking by the age of 1, but if a child can't even stand on their own by 1.5 years, this is a red flag. So by 2 years on the other hand, if they're not able to put words together or have a vocabulary of less than 20 words, if they can't play in a meaningful way, where they have stereotypic play, which means that they play the same kind of way over and over again, maybe just lining cubes in one line or spinning the wheels of a tire. That's again one of the signs of a red flag at the age of 2.
Okay, all right. So I think we have lots of clarity based on this chart as well. Very nicely put. 18 months all the way to 5 years. And of course, it's easy for parents to monitor from there as well. So this is, of course, now going to lead me into the next part of the question, of course. If at all parents were to detect any of these red flags, as we call it, what can parents do if they notice this? And what else can they do to optimize their child's development? Because I think a lot of parents sometimes, as much as, we don't like to say it, but it happens very naturally among parents, I would say, that it's always the whole comparison that's being done as well. If you were to have a relative, or perhaps you have a friend who has a child in the same age group, and if one goes ahead and does something first, if it's talking or reading or any of that, a lot of parents also sort of panic in a way. All right, I think this happens very often among most parents around us, as we see. Or even if they do detect any of these red flags, which are quite evident, or like you have given us a very good chart with clarity there. So what do you think parents can actually do, and how do they actually optimize their child's development? So over to you again, Professor Norazlin.
So the chart that we had on the previous slide showed the red flags at specific ages from 18 months to 5 years. So if children at this age does not reach this specific milestone, parents firstly need to be aware, right? Need to be aware, this is what my child should be doing at this age, right? And if they're not doing it at this age, not to worry them, but of course to be aware of what's normal development, is for the parents to get some help, right? So if their child is not, for example, by the age of 4, has not playing with friends, has poor memory for words and numbers despite instruction, has no concept of color after being taught, they seem to forget what they were taught over and over again, doesn't ask questions like why or what. So these are signs at specific ages that the parents need to bring this child to the attention of a professional. So of course, what I mean by that is that I think the easier thing would be bringing the child to their pediatrician, right, first. So younger children might be brought to the clinic kesihatan, older children can be brought to a pediatrician. People who actually specialize in child development are trained further. For example, these are developmental pediatricians like myself. So developmental pediatricians can also go on to diagnose children with specific developmental conditions. But your first stop can be your pediatrician. Other people who can also help with this, other than pediatricians, are, for example, family medicine specialists, child and adolescent psychiatrists, clinical psychologists that can help give clarity about what's going on with the child. And the kind of resources that parents can use to try and figure out whether the development of the child is normal or not is to look at things like buku kanak-kanak. When a child is born in a government hospital, they get given the blue or pink book. And in the blue and pink book, there are various things that can be helpful, including developmental milestones. Apart from that, they can also look at other resources like My Positive Parenting or CDC tracker for developmental milestones. So there are actually free apps nowadays that you can use to track your child's development. This is not to worry parents, but really to empower them so that they know what is normal development, so they can pick it up early and bring it to the attention of their pediatrician or health practitioner. So what can we do to help? Of course, children learn by interacting with the environment, by doing things, right? Unfortunately, for the past almost 3.5 years, for a large part of that time, children didn't have the opportunity to do that. But what they need to do is actually to have opportunity to go out and play with friends. They need toys to play with. They need opportunities to run around. They need things that they can do to stimulate them. Things, for example, like reading that can help improve concentration and memory. Playing with other children so they can understand other people's reactions, and also strengthen their social and relational skills. So really early stimulation is very important because a young child's brain is still developing. And what we learn is what we are actually able to retain, and the cells in the brain, the connections between the cells in the brain are stronger if we have those kind of experiences. So we will retain knowledge of the kind of experiences that we've been exposed to. So if we don't have those experiences, then we won't be building those relationships or the connections between the cells of the brain. And this is what happens in very young brains. So early stimulation is very important. But in addition to early stimulation, children should also grow up healthy. Like we mentioned, healthy bodies. Yeah. What do children need to have healthy bodies? They need to be able to have enough rest and sleep. They need to be able to, as we mentioned, play. They need to have a good diet. They need to have enough stimulation that they're not just stuck doing one kind of thing. So for example, in the case that you mentioned, the child watched quite a lot of, there's a long period of screen time. He was using, watching
6 hours in a day.
Yeah, that's right, 6 hours, which really means that for 6 hours of his day, he's not doing what he should do to help stimulate his development. He's not talking to other people. He's not playing with other children. It takes time away from him doing things that helps his development. Yeah.
All right. Okay, so that is also very important with the early stimulation that you had spoken about. So maybe Professor Firdaus, maybe you want to share with us your thoughts on this as well?
Yeah, the one that Professor Lin has shared, is actually has covered quite a lot. Maybe I can share before parents can actually get the appointment with the hospitals, clinic. Some hospitals needs they have like quite long process, before you get the date of appointment. So what is actually parents can do at home, okay, while waiting, okay? That doesn't mean that how severe is your child, there's nothing that you can actually do at home, okay? So basically, I would like to encourage parents, okay, to create the supportive environment, okay, safe and supportive environment by doing PAX activity. What is a PAX activity? P is stand for physical activity. Okay, so what is a physical activity that you want to do with your child? Okay, you can walk together, run, jog together. Yeah. E is emotional activities. What kind of emotional activity that you can create a safe and happy environment at home? Okay, yeah, you don't need a doctor to actually to get the skill for you to make your child to laugh. Okay, so you as a parent, so this is something that you can actually create activities at home. Then C is a cognitive. What is the cognitive activities that you can do at home? Yeah, some like problem solving skill activities at home. And the last but not least is the S, social skills. Yeah, so that is where you can promote the social interaction. Okay, maybe you're talking with your husband and wife. Yeah, what is actually that you say to your child while changing the diapers, when you help them to shower, while eating. Okay, while brushing teeth, what songs that you sing together. Yeah, so this is something that actually can be done at home. Yeah, while waiting for the doctors or the specialists to actually understand, give the better understanding of the child difficulties.
Okay. All right. So since now we have this very, very clear understanding of this as well, I also have another question. And thank you so much to Professor Norazin as well as Professor Firdaus for giving us a very clear a breakdown of it. Even if you do not go over to a pediatrician, there are things to create at home for your child with the environment. So thank you so much for giving us all of your perspectives and the answers to all of our questions. But I do have another question out of curiosity as well, because, you know, as we have also made it quite clear here about how various factors could also affect your child's growth and, you know, your environment and all of that. So we also recently faced, of course, the pandemic. So when we talk about the pandemic, a lot of kids, of course, were quarantined. They also had difficulties in going out and meeting people. So there's also a very big change here if we talk about the pandemic. And, you know, it definitely, I'm sure a lot of experts would also agree on this, that it may have affected the child's early development or growth. So what is your take on that for both of you? Maybe we can start off with Professor Norazin on this.
The first question, does a baby aged 1 to 12 years face emotional... Oh, sorry. The pandemic, I beg your pardon. I was looking at the screen. So for the pandemic, I was mentioning about how in the past 3.5 years, children have really, not just children, all of us really, have been, you know, at various stages in lockdown and, you know, been in the pandemic and post-pandemic stages. So what has happened is, it's affected all of us, not only the pandemic itself, but also the effect of trying to control it, especially with the lockdown and the social isolation. Of course, that needed to happen, but there are consequences from that. In children, for example, being locked up at home and not being able to go out, of course, has affected their ability to experience what they should normally experience growing up. So imagine, you know, being stuck in a house between 4 walls when you're a baby or you're 1, 2, 3, 4 years old for a very young child.
I think, of course, even the adults also really felt it. So what more the kids?
Exactly. So if even the adults feel stir crazy and feel like you're not going to be able to survive this for much longer, you can only imagine what this can do to a child who actually needs a stimulation, who needs a space to run, who needs to meet other children, needs to play, right? So a lot of
But I'm
problems...
sure, Professor, sorry, go on.
No, sorry. Yeah, I was saying that a lot of the issues is for children because they don't tend to, they didn't have the brunt of the problem with the infections, right, with COVID. But they were the ones who had the impact of the social isolation, I think one of the biggest impacts, right? If you can imagine the impact on us, the impact on them is even greater because they can't even go out of the house. They're stuck inside. So the social isolation itself has actually, we've seen that there are a lot of children who've had their development affected by this, emotions and development, I think, affected by this. So for example, one of the areas of development that we see has been really impacted is the speech hearing language, because they've not maybe had opportunities to be with other children, opportunities to talk with other children and people, as well as social emotional, right? So both language, social emotional. So in my clinic in University Kebangsaan Malaysia, we have so many children that have come to us post-pandemic that have been brought by their parents because of speech delay, because of them not having had normal opportunities to play. So it's really a big effect on the children, and they have to do a lot of catching up in this post-pandemic period. You know, so it's actually
the patching
been
up
very
is the most important thing that we should be highlighting about is, you know, the patching up. And well, the pandemic was not something in our hands, but what we can do now is to make it right, at least, for kids.
That's right. Yeah, I mean, they might not have. Most of them didn't get the infection, but they had the impact of being staying at home, the social isolation. Yeah, and we're still paying the price of that even now.
Yeah, unfortunately, but I think you would agree with me on this, Professor, that I think a lot of Malaysian parents, I would say, they did do a very good job with keeping their kids entertained at home as well. a lot
Right.
of them
So
started spending more time with their
yes.
kids, I guess.
So yeah, that's true. We have to give credit to parents and how hard they work. But keep in mind as well, because we've been stuck at home, there's been a lot more use of screen time, gadgets, television. I mean, part of it is unavoidable. This itself, we're on a we're in a virtual setting. But
Yeah.
if you imagine a child being exposed to that for many, many hours, especially a young child, it's not a good, it doesn't have a good impact on their development. It really takes away from other opportunities that they should have for a normal development and normal childhood.
All right. Thank you, Professor Nurazin, on this. So what about Professor Firdaus? What is your take on the whole pandemic situation as to the question that I posed out earlier?
Right. Okay, I understand from your perspective that there are good things, there are things that we should be thankful as well by having the pandemic recently. Yeah. Okay. Maybe the one that I want to highlight is the changes. Yeah. Whenever there is a changes in in our life, okay, there'll be some kind of adjustment. Okay. So the issues of parental stress and household dynamic that might concern that will affect the whole family dynamic or affected the children much. Okay, when parents change, yeah, whether to positive or negative, okay, it will affect the whole household. Okay, and it will affect the children. Okay, so this is why is this happen? Okay, when parents is stressed, they've got to deal with the changes in the academic system, okay, the learning system, okay, they have to change their personality as well to suit the demand of the academic and also the changes of the children personality and the routine as well. So that is something that why we are concerned, what we are actually seeing the impact of the mental health and also the psychological or emotional issues after pandemic. Yeah, so not just for the children but among the parents
as well. All right. Thank you so much, Professor Firdaus, as well as Professor Nur Azlin. And I'm really glad because I think we covered quite a number of scenarios, as well as even focusing on how the pandemic has also affected the kids' growth and development. All right. So once again, to all of our viewers, we hope that you're enjoying this session and you're taking down your notes as well. And as I've mentioned earlier, we will be having our Q&A session. So if at all you have any questions for us, we still have a couple more minutes and you can drop in your questions via Slido and we will try our level best to answer all of it. So we're going to start off now with the very first question that we have received. And this one is on a child aged between 1 to 12 years, all right? And the question is, does a baby or a child aged 1 to 12 years will face any emotional depression or stress at this immature age? So to any of the professors who would like to take this question?
Okay, right. So below 12 years old, children, okay, or primary school kids as well. Okay, so first of all, we have to understand what is stress. Yeah, stress is actually divided into 4 categories. Yeah, so people can stress not just in terms of emotion. We can stress our cognition stress. Yeah, in terms of our thinking style, in terms of the contents that you are thinking of something. Yeah, negative. And then physical stress, and then also behavioral stress. Yeah. So when children below 12 years old, okay, when they experience all this negative event, okay, or negative label from their peers or their family members, they could also experience stress. Yeah, be it the emotional, physical, behavioral, or cognition. Okay, so they started to have all this input in their brain, okay, and that from the way they think about life, about problems, about people around them, who actually giving the pressure or stress to them, okay, that will affect their emotion, okay, they started to feel sad, and there's no validation among the adult, okay, about their feeling. That's why they started to change their behavior, okay, as the red flags, the one that I mentioned just now, okay, maybe changing in terms of their behavior, their emotion, their sleep, and also appetite pattern, okay. And what I can highlight more from the first 5 red flags that I mentioned earlier, there are 3 more that is also important for this age when they have they experience prolonged stress or emotional distress. Yeah, they could also regress, yeah, in terms of their development. okay, thumb sucking, sometimes they bedwetting just now, okay, they regress their development. And last time, in the first 6 years, maybe they are normal, but when they feel stress at school, okay, among the peers, they could actually regress their development. They back to the young kids style, yeah. And the other one is academic declination. Okay, so this is something I think like by the age of 7 to 12, okay, you have some activities at school, yeah, examinations and whatnot. So this is something that could also give the indicators that they are struggling about something because they want to achieve something, yeah. So parents didn't actually focus on how much they actually learn, what actually they have to be measured at school, but they just put the expectation. I want A, I want 100, yeah. So, but they are the one who actually need to put the focus, concentration, and also accept whatever from the teacher's perspective. And the last point that I want to highlight is when there is issues with emotion among these years of age, yeah, they could also experience a self-destructive behavior. They start to blaming themselves. They start to when their feeling is not being validated, okay, they could actually feeling numb or empty. So that is where the part that they feel like ending their life is better because adult will be happier without my existence, okay? And then that is where they start to involve in the self-cutting or self-harm behavior. Okay, so this is real, and this is very important to understand, especially among our kids between 1 to 12 years.
All right. Thank you, Prof. And I think, it's safe for us to say that it all relates back as well, yeah? The cycle of it, with the red flags and all of that. Yes. All right. So to our audience, we hope you are taking in all of your questions and you are receiving the answers that you want to hear. And of course, we still have more time. So I'm going to dive straight into the next question. All right. And this time it is about a 4-year-old child who experiences night terrors, wakes up, weeps, and maybe suffering, maybe suffering from an illness. So what is your take on this, Prof?
I want people to understand from medical perspective first before I jump into psychological notional practice.
Yeah. So some children can get night terrors. That can be part of what children go through in childhood. It can look quite scary for parents, but it can happen in some children. We try and see whether what the child's environment is like, what the child's been going through, and make sure that we're not actually missing any medical issues. So when we take a history, we try and find out whether there was anything that happened before that, what's been happening in the child's life at home, at school, whether there have been any changes, and of course do a full physical examination to make sure that we're not missing any medical diagnosis, right? Sometimes some children can get overwhelmed with certain things when there are changes in, for example, if a 4-year-old has just started school and some of the aspects of that is overwhelming. We can find that in some ways that their mind reacts to that by having these kind of behaviors, for example, like night terrors, right? So it's firstly understanding that in part of childhood, some children can actually have this. Not all children will undergo it. And the degree to which they might present with it, it can be different. So we try and do a holistic view looking at what are the things that are going on in the child's life in terms of the history, looking at the family background, and also examining to make sure that we're not missing any particular medical conditions that might lead to it.
All right. Thank you, Prof. So examining as well. Yeah, that's also quite important for us to add on. All right, to the question. All right, so now moving over to the next question that we have. And of course, once again, to our audience, we will try our level best to answer all of your questions. Okay. So the next one that I have here is, Doctor, what is your opinion towards punishing or scolding children to educate them when they did something wrong? I think for this one, it will be great for us to go back to Professor Firdaus, because I remember this chart that you had showed us about the types of parenting style as well on this. So maybe you want to elaborate further on this question.
Okay. When parents choose to punish school children, okay, is it wrong? Okay, I believe that some of us also been brought up in this way. Okay, But what is wrong is when you don't explain what is wrong about the behavior, okay, the things that I did, okay. So this is something that is missing to many parents. Yeah, they punish their school because of emotion. They want to feel satisfied, you know, by doing pain, by giving pain to the children, so they will change. This is not something that is right, yeah, because through painful, yeah, through giving the punishment with emotion, with negativity, yeah, doesn't actually help children to actually to be better or to be stronger or to understand and not to repeat the mistake. Okay, so this is something that parents thought that it will definitely will change, and then you will learn, listen, and you will remember this forever. Okay, but yes, maybe that there are children who remember this forever, but with scars, yeah, with really struggling, prolonged stress throughout their life, okay, or throughout their development. Okay, so this is something that for me, okay, there will be a limit, okay, in terms of what is it that you want to punish, okay, what is it that you want to scold children, okay, as part of the educating them, okay. But most important, if you got to explain, yeah, you must make sure that your expectation is rational, okay, and then you must make sure what is the consequence of your penalty, and also the consequence to the children as well, because there will be different developmental age for the children to understand what actually the parents are doing in terms of the reward and the punishment.
All right. Thank you so much, Prof. And I think, again, it goes back to a balance of it as well. At the same time, educating your child as to why a punishment is being carried out, right?
Yeah.
Okay, so now we'll move forward to the next question that we have here in our Q&A session, and I hope all of you are enjoying this session so far. And we are still taking in a couple of questions as we have a couple more minutes left before we wrap the session up. So the next question is, my child was just diagnosed with autism spectrum disorder. So what are some tips for parenting kids with autism? What are the tips that we can actually share with parents?
Okay. So firstly, just for the benefit of the audience, we make a diagnosis of autism spectrum disorder in children in which we see differences in two areas. Firstly, that there's a problem with social communication, where the social communication is not quite like what you expect of a child of that age. For example, having problems with verbal and non-verbal communication, like having poor eye contact and not communicating when they use their words to speak, and also problems with socialization. The second area of difficulty or impairment that we see in children with autism is restrictive repetitive behaviors, interests, and activities. And these can be seen when children have, for example, stereotype play, stereotype motor behavior, or speech. Stereotype means doing it over and over again in one particular way. For example, a child who just repeats the same thing over and over again, or a child who does the same movement like hand flapping or tiptoeing or spinning, or a child who plays in a stereotype way where they play just by lining up objects or spinning the wheel. The other areas of behavior in which we see autistic traits are when a child is quite rigid or wanting to do things in his own way, rituals and routines that have to be done a certain way, and if the child is not able to do it, it makes him quite distressed. Children with autism also tend to have restricted interests and activities, meaning they like specific things. For example, dinosaurs. So there are some children with autism who have delay, but they know all the names of different dinosaurs, even though I can't pronounce them, right? But they can pronounce it better than I can. And lastly, difficulties with sensory issues, whereby, like Prof. Firdaus mentioned about sensory issues earlier, they could have sensory hypersensitivity or sensory defensiveness or sensory seeking behavior. This shows that in some children with autism, when it comes to certain sensory input, they can struggle with managing it. Either they find that it's too much, like a sound is too loud and they need to close their ears, or a certain tactile sensation is too much, so they don't want to touch certain textures, or don't want to walk on the beach, or don't want to have their hair cut, or they're looking for certain sensations, like putting things in their mouth or smelling things, where they're trying to get a certain sensory input. So we see these difficulties in the two areas for children with autism spectrum disorder, but children with ASD can present differently from one child to the next. They can be mild, moderate, or severe, and each child's presentation can be different. So because of that, it really depends on what the child is like, right? But the two areas in which it might be helpful to help the child is firstly to help with social communication. So in children who are not yet speaking or not communicating well, we try and get them help to communicate better, not just in improving their language, but also in how they use it. So pragmatic language, and also for social communication. So using language to communicate with others, language and non-verbal communication. Secondly is, of course, with those behaviors. So for children who have a lot of problems with sensory input, so they might need some management of that. Reduction of the things that makes them upset, and also getting them used to certain sensory input, right? So they have some exposure to it, and they are able to modify their response to sensory input. There are also other areas of helping children with autism. For example, generally a structured set of activities is helpful for them, meaning that they know when they're supposed to go to school, when they're supposed to sleep. It helps. Preparing them for when there are changes, because children with autism can really struggle with transitions or changes. So preparing them for that, and helping them when they're having challenges with that. Also using communication ways other than hearing and language and speech, which, for example, we can use visual tools, augmentative communications using pictures and so on, to help the child communicate. So really it depends on the child and what his needs are. In this sense, I think seeing a doctor, seeing a therapist can really help. But of course, parents can also read up from reputable sites on autism to try and understand what their children are like, and to try and be patient with their child, be patient with themselves, and understand the child so that they're able to support their child best.
All right, great tips on that. Professor, thank you so much for taking in that question. All right, so now moving on, we are down with our last two questions for our Q&A session. And the next question that I have here is, can a child be raised primarily by grandparents for the initial years, for say about 6 years, and reason being that parents are busy? Are there any consequences for this child? I would say this can be a bit of a sensitive question, because some kids enjoy being around their grandparents as well, right? So maybe for this question, Professor Firdaus, do you want to answer this one?
Okay, right. The first 6 years is considered golden years for the children. Yeah, so this is the years that we really need to have a good brain cells connection, because this will affect their emotion, their behavior, their cognitive development and whatnot. Yeah, so either being raised by the grandparents or that busy parents as well. Okay, it all depends on what type or what styles of parenting styles that they are actually using to approach their children. Okay, so if the grandparents are handling with responsive style, okay, I believe that is creating the safe and supportive environment for the child. Okay, because one thing that we must understand at the age of the first 6 years, okay, the child needs to develop the trust, okay, to the adult, towards the adult. Okay, so if they don't trust, if they break the trust, yeah, they don't have the affection, they don't feel love, they don't feel appreciated by the adult. Okay, so that's a lot of consequence later on. Second thing is by the age of 5, 6, yeah, they have to develop the sense of autonomy and independence. If they're being raised by the grandparents who are permissive or indulgent or neglected just now, okay, so they might actually end up poor resilience. They don't know how to do problem solving in their life. Yeah, they have difficulties in terms of social interaction, and also that's affected their development. Okay, so same goes not just for grandparents, but for the parents who are applying the permissive or the neglected parenting style. So I believe if the grandparents or the parents are not actually applying what they have been learned from their own experience, they try their best to actually to become a positive or responsive way of parenting, the child is will be will be living in the very resonant and also healthy environment.
All right. Thank you so much, Prof, on this. So, the way to put it, I guess, is the key is that to spend as much time with your kids in that first 6 years. Yeah, Prof?
Yes, yes. And the busy parents also must also need to be highlighted because how busy you are, because that is your biological children, okay? You must find ways in order to show that your love and affectionate to the child regardless of the reason of your life is.
All right, great advice on that, Prof. Okay, so now we are going to take in the final question for our Q&A session. And this question is it normal for a child aged 7 to 8 years old who is resistant or gets upset at being corrected? Or in Bahasa Melayu, we would say kena tegur. All right, so what could have caused it and what can be improved?
Okay, right. Okay, by this age, okay, 7, 8 years old, child already understand the concept of self-concept. They understand who they are, okay, what their gender, what is the expectations of the others. Yeah, so this is, I believe, if they have difficulties to accept the comment, okay, or the challenges by the adult or by their peers, okay, or by their teachers, this is might be because of they are living in the high expectations adult. Okay, sometimes parents put up the high expectation, and if you don't meet this expectation, there will be a penalty. Okay, so the fear of doing mistake or flaw in their life, that's why they have difficulty to accept this when they are actually engaged in the social context, especially at school or among their peers. Okay, so this is something what we would like to understand, for parents to understand is, by this age, they have started to develop the concept in their cognitive milestone about themselves, about others, as I mentioned just now, where they have already understand the issues of labeling, the issues of expectation just now, when they understand that because of certain labeling, like say you are stupid, you are not good, okay, that make them feel bad, okay, and that will affected their behavior. Okay, so basically it's a concept of cognitive behavioral approach in which whenever the person have received any negative label, okay, so that is actually they associate of what they are actually expected from the adult or from the people who they are trust to say that negative label, okay, so that is actually affected their feeling, okay, biologically we will be affected of any negative remarks from other people, okay, that will affect their behavior. Okay, so the way you think will affect the way you feel, will affect your behavior. Okay, so by this age, if a child who get corrected by the teachers or by the adult, okay, so it's difficult for them to actually to be okay, okay, because they have set certain expectation for the adults that they must actually love me. They shouldn't actually corrected me in front of other people. Okay, I've done my best. They should praise me. Things like that. Okay, if this is not happen, if they didn't get this, that's why they feel negatively and also affecting their behavior dysfunctionally. Okay, so basically by this age, we have to be very careful because they absorb all the words from the adults, all the things that they have watched, okay, and they will start to actually to compare with their peers and with their real life. Okay.
All right, so the key here, I guess, Prof, is that for parents to be extra careful and also to be very, very, to give extra attention to what they say and how the environment is for the child, yeah? Especially because, it all relates back to the behavior and their expectation as well as their reaction to things. All right, so thank you so much to both of our professors for answering all of your questions. And of course, to our audience, thank you so much for dropping in all of your questions. And this also wraps up our Q&A session. So before we bid farewell over here on this platform, I would also like to hear it again from our professors. So we can start off with Professor Nur Azlin. What is your last words, I would say, or advice that you would like to give to any of the parents out here on this platform who are listening to us right now?
Yeah, I'd say spend time with your kids, enjoy them, play with them, do things as a family, especially now that we can actually go out and do things. So we have a lot of catching up to do. So yeah, enjoy them and get to know them, get to know them as people. So yeah, I would say enjoy your kids and spend time with them.
All right, very nicely said. And what about you, Professor Firdaus?
Okay, I would like to put the take-home message for everyone to practice 3R. Yeah, 3R. First of all, you must relax. Okay, in dealing with children, in understanding this, all the children difficulties. First, parents have to relax. Okay, and then the second R is reconnect. Okay, then only when you're relaxed, you're able to connect. What is their behavior? What is the problem? What is the issue that you want to solve? Yeah. And the third one is to recharge. Okay, you got to recharge first. Okay, in order for the kids also to recharge, in order to correct, in order to change their behavior, or in order to accept all the advice by the parents. Okay, so 3R: relax, reconnect, and recharge.
All right, great advice there, Professor Firdaus. Thank you so much. So once again, to both of our professors, thank you for your time, for your effort, and of course, for giving us a clearer picture on the topics here today. We truly, truly appreciate it.
Thank you.
All right, so ladies and gentlemen, that is all the time that we have here on today's platform. However, we hope that we would be able to see you again on the next forum session that we are about to have, which is happening on the 29th of July on Saturday at 8 p.m. And this time around, we will be talking about a different topic, of course, and the theme is Shine in School, Help Your Child Flourish with Nutrient, Lifestyle, and Growth. And in order for you to join in, well, it's easy breezy. All you have to do is just scan the QR code, or you could visit our event page at the Malaysian Pediatric Association Facebook page to learn more. And of course, share it with your colleagues, with your friends, with your families, especially for parents who think that this will be beneficial for them to have a better understanding and a clearer picture on the topics as well. And of course, for those of you who have participated in our Touch and Go contest for today's forum, thank you so much. We truly appreciate it. And stay tuned for tonight's winner announcement. Okay, actually, we are not going to be announcing the winner just here on this platform, but we will be contacting the chosen winner via email in perhaps about a week's time. All right, so let's all focus and bring together the focus on our healthy growth for our children in this Growth Watch month. So lastly, before we actually wrap things up and we bid farewell, we would also appreciate for you to take your time to give us your feedback and let us know exactly what you think about our forum series. Okay, and you could also just scan the QR code and drop in the feedback forms right here. All right. So once again, ladies and gentlemen, thank you for joining us, and we hope you have enjoyed the session. We hope to see you on our next session, which is on the 29th of July on Saturday at 8 p.m. So that's it today for me. I am Jaleesa Sanjana signing off this platform. See you and good night.